The breastfeeding clinic is a specialist care reception for any issues with breastfeeding. To start with, a woman visits primary care. If that advice and support doesn't help, then the woman can book a video appointment at the breastfeeding clinic. It could be, for example, a problem that makes the interaction between the mother and child difficult. She may also come across a problem when the health centre is closed and you need to book in time. A big advantage of online consultations is that you can book them around the clock. For us in the clinic, the biggest challenge in getting started with online consultations was the skepticism about using new technology. Swapping the visit on location with sitting at a computer and meeting the patient there. Many thought it felt uncomfortable, so we had to strip off the drama. Then we just decided. We start now. The first appointment went really well, and this boosted the midwife's confidence. They got feedback from patients fairly quickly, and they understood that this is really good. They also saw the benefits of seeing the patient in video, the woman and the child in their own nursing environment at home, compared to, for example, a phone call. And they discovered a video appointment was sufficient help. Our success factors have really been several, is much more sufficient today. Part of it is that the midwives work much more efficiently today. A physical appointment is difficult to manage in less than an hour. The patient has to come into the room, prepare, then the child will get up, you have to breastfeed. Then there is a closing procedure. Now, with video consultations, the patient is already prepared and it can be done in 20 minutes. In turn, the midwives have more time for more visits per day. As video consultations increase, physical visits to the hospital have decreased. It provides a great screening for the patients who actually need to come in for a physical appointment. This enables us to reduce the number of unnecessary visits to the hospital. Looking at the work environment, a major advantage for the staff with video consultations has been stress reduction. Previously, we had an answering machine where the patients called. You could not control the incoming flow, nor the time of the call. It had to be done during the daytime. Now the patients have already booked a time, and the midwife knows exactly how many visits and contacts she has per day. We follow up how our patients are doing, and if they're satisfied via a patient survey. And then it turns out that they are very satisfied with the video consultations, at a 96%. And then, of course, it is important whether the video consultation was enough to cover their needs. Here, 83% responded that the help they received covered their needs. Now that we have seen how well it works for women who seek care and help for breastfeeding, we have started thinking about what other groups could get help in the same way. Following up on aftercare is a very big part of our operations, and we see great benefits for new mothers and their babies, as they can skip coming to the hospital for advice and support, and instead, we can offer them through video consultations. If we were to give advice to a healthcare unit that wants to start with digital healthcare, the first thing is, there's no need to wait, and you will learn as you go. The platform is very user-friendly, and we have great support from the start. It's so important to make sure that you are supported.